Hi, my name is Dr. Josie Syverson. I practice family medicine at CentraCare Benson. I want to tell you today about options that CentraCare has available for acute care outside of the clinic setting. The first one is called virtual urgent care. It is available 24/7 for patients with MyChart, and this is a video visit platform for conditions that are what we would consider acute, such as respiratory infections, possibly skin rashes, urinary conditions, and these would be a quick way to be evaluated by a provider in a face-to-face manner at your convenience. Another option currently available is CentraCare's eClinic. This is another online platform, doesn't require MyChart or a face-to-face video visit, but can be used for similar things, acute conditions, skin conditions, coughs, colds, fevers. This may be an appropriate option for you where you can enter this questionnaire online. Response time should be within 1 hour, and this is just a small out-of-pocket fee for this service. The final option I want to talk about today are primary care video visits. This is going to be during the primary clinic day, but is a great way to follow up on mental health conditions. Even primary wellness visits can be done this way and just needs to be coordinated through your primary care provider. So for most respiratory infections that we're going to encounter this fall and winter, having up to 5 days of fever is acceptable. We know we can treat fever with Tylenol and ibuprofen for most patients, as well as drinking plenty of fluids, getting plenty of rest. When you have a respiratory infection, it's going to be recommended to not attend school or daycare and work until you're at least 24 hours fever-free. For children and adults, if they're experiencing difficulty breathing, chest pain, dizziness, passing out, or signs of severe dehydration. For children, that would be children in diapers, less than 4 diapers in 24 hours. Those are all reasons that we're going to want that patient seen in the clinic or emergency room setting, depending on the time of day and the severity. So a reminder as we enter cold and flu season is there are people of higher risk status, such as elderly and those under age 2, that may require an in-person visit to get the most appropriate care. Our virtual urgent care and eClinic are only available for age 2 and older, versus the infants may require an office visit. But as a reminder, young children also get frequent respiratory infections during this time of year, and they don't always have to be seen right away on day 1 or 2 of their fever. So for adults, people with high-risk conditions such as COPD, chronic kidney disease, and congestive heart failure, these patients may require imaging such as a chest X-ray or having labs obtained. That usually does require an office visit in order to serve those patients most appropriately. There also may be times that you're unsure if you require a clinic or in-person visit. In that case, you could call your clinic or CentraCare's nurse line to talk to a nurse, give your symptoms and information, and they could guide you through our virtual urgent care or the in-person option. Thank you for listening today. For more information, you can visit CentraCare.com to learn more about our virtual care options.